Hello everyone and welcome back to EverlastCyber. We'll be going through the part 9 video in our series for the NACC PSW certification exam. Let's start right off with question 1. A PSW notices that a client's dentures are missing after breakfast. What is the best immediate action? A. Report to the nurse and check the dining area. B. Wait until lunch to see if they appear. C. Ask another PSW if they've seen them. D. Ignore it since dentures are personal items. As a personal support worker, when you notice that a client's dentures are missing, the first thing you should do is to report to the nurse immediately. Immediate action is required because dentures are essential for eating, speaking, and comfort. So, the immediate thing to do is to report to the nurse, and then you can go ahead and check the dining area because sometimes dentures are often missing on napkins, trays, or even accidentally thrown away with food waste. In option B, waiting until lunch or asking another PSW, like in option C, this delays appropriate action, and ignoring it in option D would be entirely neglectful. So, early reporting and searching helps to prevent damage or loss, as well as maintain the client's dignity and health. So, we'll be going with option A. That is the best immediate action to do. Question 2. When caring for a resident's hair, what should the PSW try first if the hair is very tangled? A. Call the nurse in charge. B. Wet the tangled hair with alcohol before combing. C. Cut out all the tangles. D. Comb one small section of hair at a time. For option A, while we have to report to the nurse in case of anything. Healthcare is within the PSW's scope, so calling the nurse in this situation is unnecessary unless there is a medical concern. That's when you can go ahead to call the nurse. In option B, alcohol dries out hair and can even irritate the scalp, making detangling more painful. In option C, cutting out the tangles should be a last resort, and this would usually require the family's consent or even professional hair care. It is not a standard practice for PSWs to cut a client's hair. When a resident's hair is very tangled, the PSW should use gentle, patient techniques to avoid causing pain or damage. So, for this, we'll be going with option D. What a PSW can do is work in small sections to carefully detangle the hair. Use a wide tooth comb or detangling brush if it is available. Then start from the ends and then work upwards towards the roots. Remember to be gentle and patient, especially with residents that may have sensitive scalps or dementia. Question 3. When assisting a client to transfer from bed to wheelchair, where should the wheelchair be placed? A. On the client's weaker side. B. On the client's stronger side. C. At the foot of the bed. D. At the center of the room. In option A, placing the wheelchair on the weaker side will make the transfer more difficult and unsafe. The client will struggle to pivot or push up with limited strength or balance, and this increases the risk of a fall or injury. When assisting a client to transfer from a bed to a wheelchair, safety and stability should be the main priority. So, placing the wheelchair on the client's stronger side will allow the client to use their stronger arm and leg to support themselves during the transfer. This would provide better balance, confidence, and control, and even help to prevent falls or injury. In option C, this position is awkward and unsafe for transferring because it requires unnecessary movement and twisting, which can cause imbalance or even strain on the client. In option D, placing the wheelchair at the center of the room provides no support or stability and even increases the risk of a fall. So the wheelchair should always be close to the bed and on the stronger side for the safest transfer, and that is option B. Question 4. A state of illness that comes on suddenly and may be of short duration is called A. Overt, B. Chronic, C. Acute, D. Congenital. Overt means something that is obvious or clearly visible. It has no relationship with the duration or onset of an illness. Chronic is something that develops slowly and lasts for a long period of time. It can often stretch into months or years. So, for instance, diabetes or hypertension is referred to as a chronic condition because it develops slowly and lasts for a long period. An acute condition or illness is one that comes on suddenly and is of short duration, while congenital refers to a condition that a person is born with, such as congenital heart defects. So, based on the options, the correct answer will be option C. Question 5. You're helping a client with dementia dress for the day. They insist on wearing pajamas to the dining room. What should you do? A. Allow them to wear the pajamas and notify the nurse. B. Argue until they agree to change. C. Forcefully change their clothes. D. Ignore it and move on. Remember, clients with dementia often experience confusion, poor judgment, or even resistance to care. In such cases, your role as a PSW is to maintain the client's dignity, safety, and emotional comfort, and not to force compliance. Allowing the client to wear their pajamas will avoid confrontation and distress. However, you should report the situation to the nurse, who can then decide on appropriate follow up actions or behavior management strategies. This approach in option A reflects respect, patience, and person centered care. So, option A is the correct answer. But let's take a look at the other options. Option B, arguing can increase agitation, resistance, and confusion. It may even escalate the situation and cause emotional harm. People with dementia respond better to calm redirection and not confrontation. Option C violates the client's rights and dignity and can even be considered as abuse. So, physical force should never be used, regardless of the situation. In option D, ignoring the situation means failing to report an unusual behavior or change in condition, and this could indicate worsening dementia or emotional distress. Reporting ensures that the care team can address the underlying issue. So, like I mentioned before, the correct answer is option A. Allow them to wear the pajamas and then notify the nurse. Question 6. You notice another PSW not washing their hands between clients. Your best course of action is to A. Confront them angrily. B. Ignore it since it is not your duty. C. Report the observation to your supervisor. D. Warn other PSWs. Confronting them angrily is unprofessional and could even lead to workplace conflicts. Ignoring them is also an unsafe practice. This is negligence. Every healthcare worker has a duty to protect the clients from infection and ensure proper hygiene practices are followed. Hand hygiene is a critical infection prevention measure in any healthcare setting. So if you notice another PSW not washing their hands between clients, you have a professional and ethical responsibility to act, but you need to act appropriately. Now, how do you do that? First of all, you report the incident to the supervisor. This will ensure that the issue is addressed confidentially and professionally. Client safety is maintained, and then the PSW can receive retraining or guidance if needed. So, this approach in option C will prevent the spread of infection without causing unnecessary conflict. So, our answer here is option C. Warning other PSW can just lead to gossip and workplace tension. It doesn't address the issue at hand. Question 7. During your shift, a client suddenly becomes short of breath and is clutching their chest. What is your first action? A. Call for help immediately. B. Offer them a drink of water. C. Help them walk to their bed. D. Leave to get another PSW. A client who suddenly becomes short of breath and clutches their chest may be experiencing a medical emergency such as a heart attack or severe respiratory distress. Your first and most important action is to call for help immediately. Notify the nurse or activate the emergency response system. Now, while you're waiting for help to arrive, you have to stay with the client to reassure and monitor them. Ensure that they are in a comfortable position and do not give food, water, or medication unless directed by a nurse or doctor. Offering them a drink of water in this situation is dangerous because the clients could choke or aspirate, especially if they are struggling to breathe. In option C, movement can increase the strain on their heart and lungs, thereby worsening their condition. The client should not be moved until they have been assessed by a nurse or healthcare provider. In option D, leaving the client alone in distress is unsafe. Always call for help immediately. You can use the call bell or shout for assistance, but you have to stay with the client until help arrives. So, our answer here is option A. Question 8. Which of the following is a correct infection prevention practice? A. Wearing the same gloves when assisting multiple clients. B. Washing hands before and after client care. C. Storing clean linens on the floor. D. Reusing disposable masks for the same clients. Option A spreads infection from one client to another. Gloves must be changed between clients and hands washed after removing them. Hand hygiene is the single most effective way to prevent the spread of infection. So, washing your hands before and after client care ensures that you are protecting the clients from germs you may carry, and you're also protecting yourself and others from germs that the clients may have. In option C, clean linens must never be kept on the floor. They should be in a designated clean area to prevent contamination. Once linens touch the floor, they are considered dirty. In option D, disposable masks are meant for single use only, so reusing them increases the risk of cross contamination and infection. So our answer here is option B. Question 9. A client in isolation asks for assistance with feeding. Before entering the room, you must A. Wash your hands and apply the required PPE. B. Ask another PSW to do it. C. Only wear gloves. D. Skip PPE if you are in a hurry. When a client is in isolation, it means that they have an illness that can be transmitted through contact, droplets, or airborne particles. So, before entering their room, you must always wash your hands properly using soap and water or a hand sanitizer, and then you have to put on the required personal protective equipment. This may include hand gloves, gowns, masks, and eye protection, depending on the type of isolation. This will ensure your safety and prevent the spread of infection to other clients and staff. After assisting the client, you have to remove the PPE safely, that is, without touching the contaminated surfaces, and then wash your hands again after leaving the room. In option B, asking another PSW to do it is avoiding your responsibility and it doesn't address infection control. All staff must follow the standard precautions when assisting clients in isolation. In option C, gloves alone may not provide full protection. The type of PPE will depend on the isolation precautions, so you must follow the posted signage or facility policy. In option D, never skip your PPE because this puts you, the client, and others at risk of infection. Being in a hurry is not an excuse for unsafe practices. So the correct answer here is option A. Always wash your hands, apply the PPE, and wash your hands again after leaving the room. Question 10. A PSW notices that a client's care plan includes do not resuscitate. During a cardiac arrest, the PSW should A. Start CPR immediately, B. Wait for the nurse to confirm, C. Follow the DNR order and call for the nurse, D. Ignore the DNR and continue normal care. Starting CPR immediately in option A goes against the DNR order and it violates the client's expressed wishes and legal documentation. In option B, delaying action can cause confusion. If the care plan clearly includes a DNR, you must not begin CPR. Simply call the nurse straight away. A do not resuscitate order means that CPR or other life-saving measures should not be started if the client's heart or breathing stops. So, when a PSW encounters a cardiac arrest in a client with a DNR order, the correct action is to follow the DNR and call for the nurse immediately. This will ensure that the client's wishes and legal directives are respected and proper procedures are followed. So our answer here is option C. Follow the DNR order and call for the nurse. Question 11. A resident with dementia begins yelling during lunch. The best approach is to A. Tell them to stop yelling. B. Escort them calmly to a quiet area. C. Shout louder to regain control. D. Leave them alone in the dining room. Residents with dementia may become agitated, confused, or overstimulated, especially in busy environments like a dining room. So the best approach is to stay calm, speak gently, and remove them from the overstimulating environment. Now, if we look at the options, the best action to take would be option B. Escort them calmly to a quiet area. That's the best thing to do in this situation because telling them to stop yelling can make the situation worse. People with dementia may not understand or be able to control their behavior. So direct commands can increase agitation. Question 12. A PSW is documenting care. Which entry is most appropriate? A. Client seems lazy today. B. Client looked strange this morning. C. Client didn't behave well. D. Client refused lunch, stated I'm not hungry. Nurse notified. Now, in documentation, proper documentation must be objective, specific, and complete. Looking at all the options, in option A, this is subjective and judgmental. It could be misinterpreted and it is totally unprofessional. Option B is vague and subjective. Remember, documentation must be descriptive and factual. Option C is opinion based. It doesn't specify what behavior occurred, so it is not useful for care planning or legal records. Out of this, the best option that is most appropriate is option D. Remember, always document facts, direct statements, and follow up actions. Do not document your personal opinions or judgments. So, in option D, it records the client's words, which is I'm not hungry. It also documents what happened, which is refused lunch, and then it includes the follow-up action where the nurse was notified. Question 13. A client begins coughing during feeding. What should you do? A. Continue feeding slowly. B. Stop feeding and ensure the airway is clear. C. Pat them on the back forcefully. D. Leave to call the nurse without checking. In option A, continuing to feed the client could worsen the choking, potentially causing aspiration or respiratory distress. When a client starts coughing during feeding, this is a sign of choking or aspiration. The immediate priority is to protect the airway. So, the steps that you need to take is first of all, stop feeding immediately to prevent food from entering the airway. Then, encourage the clients to cough to clear their airway. You can also observe for signs of choking like um, them being unable to speak, or if they are gagging, or if their lips turn blue. Then you also have to call for help. In option C, patting them on the back forcefully can push the food further into their airway, especially in adults. So only gentle encouragement to cough is appropriate unless the PSW has been trained in emergency procedures where you can do the Heimlich maneuver. In option D, leaving the client alone puts them at risk. Immediate assessment of the airway is essential before seeking help. So the most appropriate action is option B. Stop feeding and then ensure that the airway is clear. Question 14. A client with Alzheimer's suddenly accuses you of stealing their watch. What's the best response? A. Search the room together calmly. B. Tell them they are wrong. C. Call their family immediately. D. Laugh it off and leave the room. Clients with Alzheimer's or other dementias may experience paranoia, memory loss, or confusion, and this can lead them to make false accusations. As a PSW, you shouldn't take this personal. You should be calm, supportive, and non-confrontational. Searching the room calmly with the client will help to validate their feeling without agreeing that a theft has occurred. It will also maintain trust and safety while reducing their anxiety or agitation. In option B, telling them they are wrong is arguing with them, and this can increase agitation and anxiety. Your goal as a PSW is to de-escalate. In option C, involving the family may be unnecessary and could even embarrass or upset the client. So the first attempt should be a calm and supportive response. In option D, laughing it off and leaving the room is dismissive and disrespectful, and this can worsen the client's paranoia and damage trust. So the best response is option A, search the room together calmly. Question 15. You are providing care to a terminally ill client who becomes unresponsive. You should A. Begin CPR immediately. B. Leave the room. C. Check their care plan or DNR order before taking action. D. Shout their name repeatedly. You don't have to begin CPR immediately. The first thing you need to do is check if a DNR is in place. Because if they have a DNR in place and then you start performing CPR, it violates the client's wishes and can be considered unethical or illegal. Leaving the client who is unresponsive is unsafe and neglectful. You have to stay with them until guidance from a nurse or healthcare provider is received. For a terminally ill client, it is critical to follow their care plan and legal directives, such as a DNR order. So, the steps to take are: first, check the client's care plan to confirm what interventions are appropriate. Notify the nurse or healthcare provider immediately, and then provide comfort and monitor while following the client's wishes. So the answer here is option C. Question 15. You arrive at the client's home at the scheduled time and she won't let you in. She says the last support worker was too slow, so she doesn't want any help. What should you do? A. Tell her to call when she is ready to let you in. B. Explain to her that you would like to discuss what she would like done and when. C. Go to your next client and document the situation. D. Call your supervisor from the nearest phone. In option A, telling her to call when she is ready ignores the opportunity to address the client's concerns. In option B, explaining and discussing preferences encourages dialogue and respects autonomy. So, when a client refuses care, it is important to respect their autonomy while also trying to resolve concerns professionally. The best approach is to communicate calmly and respectfully, ask about her preferences and concerns, and then try to reach an agreement on care. This shows respect for the client's choices and also promotes collaboration. So the answer here is option B. Question 17. What is the correct way to remove contaminated gloves? A. Pull off both gloves at once. B. Peel one glove off, holding it inside the other. C. Remove gloves by pulling at the fingertips. D. Wash gloves before removing them. Option A. Pulling off both gloves at once risks contaminating your hands because the surfaces of the gloves may touch your skin. Removing contaminated gloves properly is essential to prevent the spread of infection. The correct technique is to pinch the outside of one glove near the wrist and peel it away from your hand, turning it inside out. Then, holding the removed glove in the gloved hand, peel the second glove off, slipping fingers inside the gloves and turning it inside out over the first glove. Then dispose of the gloves safely and wash your hands immediately. This method will ensure that your bare hands never touch the contaminated surface of the gloves. In option C, pulling at the fingertips can tear the gloves and cause contamination of your hands. And in option D, gloves are single use and should be discarded, not washed. Washing contaminated gloves is not effective and can even spread germs. So the correct technique is option B. Peel one glove off, holding it inside the other, and discard it properly, after which you wash your hands immediately. Question 18. Which task is outside the PSW's role? A. Administering oral medication without supervision. B. Assisting with feeding. C. Providing oral care. D. Assisting with mobility. The other tasks we have listed in options B, C, and D are all within the PSW's role. So, based on this question, the task that is outside the PSW's role is option A, administering oral medication without supervision. Question 19. When a client expresses anger, a PSW should A, ignore them, B, argue back to show authority, C, remain calm and listen to their concerns, D, leave the room immediately. When a client expresses anger, the PSW's role is to de-escalate the situation safely. So, based on this, the best option would be option C. The PSW has to remain calm, listen to their concerns, and by so doing, the situation can be escalated. The situation can be de-escalated safely. Question 20. What should be done when a client has an open wound on their leg? A. Cover it with any available cloth. B. Report it to the nurse immediately. C. Apply ointment yourself. D. Ignore it if it's small. Using any unsterile cloth can introduce bacteria and increase the risk of infection. Only proper wound dressing should be used, and it should be done under proper guidance. An open wound, even if it appears small, requires professional assessment in order to prevent infection, ensure proper treatment, and monitor for complications. In this situation, the PSW's role is to report the wound to the nurse immediately, follow the nurse's instructions regarding cleaning, dressing, or other care, and also observe for signs of infection such as swelling, redness, or discharge. In option C, applying ointment yourself is like applying medication without training, and this is outside your scope as a PSW. This could potentially harm the client, so this should not be done. In option D, even small wounds can become infected or worsen if not reported and treated promptly. So, in this case, the best action is option B, report it to the nurse immediately. Question 21. During morning care, you notice new bruises on a client's arms. What is your best action? A, report to the nurse immediately. B, ask the client's roommates for details. C, ignore them if the client doesn't complain. D, try to cover the bruises. New bruises on a client can indicate injury, abuse, or a medical condition such as fragile skin, or it could even be as a result of medication side effects. The PSW has a duty to report any signs of potential harm or changes in a client's condition. Reporting to the nurse immediately will ensure proper assessment and documentation, investigation for possible causes, timely medical intervention if needed, as well as protection of the client's safety and well being. In option B, asking the client's roommate for details is unprofessional and it breaches confidentiality. In option C, the client may not always report injuries, so ignoring this could put the client at risk, and it is also neglectful. Trying to cover up the bruises does not address the cause, and it may even delay the necessary care. So, the best action to take in this situation is option A, report to the nurse immediately. Question 22. A client begins to wander outside the facility unsupervised. The PSW should A, run and grab them by the arm. B, ignore them if they seem calm. C, shout for help and block the door. D, call security while keeping the client in sight. In option A, physically grabbing the client can cause injury to both the client and the PSW, and it can even escalate agitation. Equally, ignoring them in option B is unsafe and it could lead to serious harm. Shouting for help may startle or scare the client, potentially causing panic or injury. And blocking exits without proper support is also unsafe. Clients, especially those with dementia or cognitive impairment, may wander around and put themselves at risk of injury or even getting lost. The PSW's priority is to ensure safety without causing injury or panic. In this situation, the best action to take is to call security while keeping the client in sight. So, by doing this, it prevents them from leaving the facility or getting hurt. Always remember, do not physically restrain the client unless you have been trained and authorized to do so, because this can be unsafe and unethical. Question 23. A client with Parkinson's disease moves very slowly during dressing. You should A. Complete the task quickly for them. B. Allow extra time and encourage independence. C. Tell them to hurry. D. Skip part of the care routine. Clients with Parkinson's disease often experience slow movement or bradykinesia, and they may need extra time to complete daily tasks. As a PSW, your role is to be patient and supportive, encourage the client to do as much as they can independently, and assist them only as needed in order to maintain safety and dignity. Allowing that extra time promotes their self esteem, independence, and also improves their quality of life. So, the best action here to take is option B: allow extra time and encourage independence. Question 24. A client's care plan indicates partial assistance with dressing. What does this mean? A. PSW completes the task entirely. B. PSW provides only equipment. C. Client participates as much as able with PSW support. D. Client is independent. Partial assistance means that the client can do some part of the task independently, but they would need help with certain steps. So the PSW's role is to support the client only where needed, such as helping them with their buttons, shoes, or zippers. Additionally, encourage the client to do as much as possible on their own. This is to help maintain the client's dignity, independence, and safety. Completing the tasks entirely, this will be full assistance, not partial, and it doesn't encourage independence. Providing equipment without hands-on help is minimal assistance, not partial. And in option D, an independent client does not require any help. So the best answer here is option C. The client participates as much as able with the PSW support. Question 25. A PSW is asked to assist with feeding a client who has dysphagia. The PSW should A. Give large spoonfuls to save time. B. Ensure the client is sitting upright and offer small bites. C. Allow the client to lie down. D. Give water after every bite quickly. Clients with dysphagia are at high risk of choking and aspiration. So, you should apply proper feeding techniques, which includes ensuring that the client is sitting upright at a 90 degrees position to promote safe swallowing. Also, offer small bites and sips in order to prevent choking. Allow enough time for the client to chew and swallow each bite, and then monitor closely for signs of difficulty such as coughing, gagging, or a wet sounding voice. These techniques will ensure safe and effective feeding. Offering large bites can increase the risk of choking and aspiration. Feeding a client lying down is unsafe, and giving water quickly after every bite can cause choking as well. So the best option here is option B. Ensure that the client is sitting upright and then offer small bites. Give them enough time to chew and swallow, and also monitor closely for signs of difficulty. This brings us to the end of the part 9 video. Don't forget to like, comment, and share, and also hit the subscribe button